The federal government says it will continue to engage stakeholders to ensure speedy implementation of the geriatric social home care for senior citizens in the country. Dr. Omokaro, the Director General, National Senior Citizen Center (NSCC), disclosed this in Abuja during a two-day international workshop on onboarding the domiciliary care agency in Nigeria. The news agency of Nigeria, NAN, reports that the event was organized in collaboration with the United Nations Department for Economic and Social Affairs (UNDASA) to ensure speedy takeoff and the operational mechanisms of social home care for senior citizens.
We have developed and published the National Policy Guidelines on Quality Assurance in Geriatric Social Care and Standard Operating Procedures for Care Settings. We have also developed and published national benchmark and minimum standards for accreditation of care settings, care agencies, and training centers. And now we are in this phase where we are facing the domiciliary care agency. Because I tell you, all through these processes, we found out through our needs assessment that this is the most preferred care setting for Nigerians. This workshop will seek to articulate the good practices, the lessons learned about the contribution of care and support system to ensure the well-being not only of older persons, the rights of older persons, but also as a social development. So the well-being of the families, the well-being of the community. So relevant stakeholders have partnered with us, as I have said, and the domiciliary care model, we say it's not new in Nigeria, like most of you introduce yourselves, and you're already operating in some form in the way you know best to do. So that we are bringing all of us together so that we understand that we all worked together to develop the policy guidelines, the national benchmarks, the minimum standards. And so this workshop is coming to align whatever we know to do to the standards that we develop and comparatively analyzing what is happening in other countries. And all of us then bringing the practical aspect of it for us to say, how best can we operationalize the domiciliary care agency in Nigeria? That we pay particular attention to global best practices, but at the same time, it is localized, carrying our cultural values.
Also speaking, Permanent Secretary, Federal Ministry of Humanitarian Affairs and Poverty Alleviation, Mr. Abel Enitan, says statistics has shown that Nigeria has a substantial need for long-term care for older persons. Enita, who was represented by Mr. Garba Hanawega, the Director, Legal Services in the Ministry, said the need is likely to increase by growing number of older persons.
As we gather here today, statistics reveal a growing need for long-term care for older persons in Nigeria due to an increasing number of older individuals with functional impairments that require assistance with daily living activities. The National Senior Citizen Center has been diligently working with relevant MDAs to identify challenges unique to our cultural context while establishing policy guidance and operational procedures in consonance with global best practices. The ministry pledges its unalloyed support of NSCC by undertaking ministerial level advocacy for more funding support.
On his part, Mr. Robert Van, the Country Director of United Nations Department for Economic and Social Affairs, UNDASA in Nigeria, underscored the need for member states to adopt comprehensive care system for older persons.
Aging is well represented in two of the guiding documents that determine the work of the United Nations internationally. One is, as you know, the SDGs and the DG already talked about this, which areas of the SDGs, of the goals pertain to older persons and the issues that are most important to them. But I also want to mention another document that has guided my work, and despite it being now almost more than 20 years old, is the Madrid International Plan of Action on Aging. This plan was adopted by the Second World Assembly on Aging in Spain in 2002, and it outlines in detail the various aspects of care as it pertains to older persons. And as was already mentioned, it goes from a continuum from long-term care to care in residential facilities, but also care at the home, domiciliary environment. And I think it's important for us to keep this in mind, that care is not an either-or, it is always a continuum, and it should be provided in the way that is most effective and reaches older persons and addresses their needs wherever they are.